B101.5, it's Dee in the morning. Our local business spotlight continues, and we are chatting with our area businesses, finding out how this time is affecting them, and of course how you can still interact with those businesses, even with everything that's going on. Our local business spotlight. And from the Center of Vein Restoration, Dr. Theresa Soto is on the line. Good morning.
Good morning.
How is all of this time affecting you guys over there?
Well, it's affecting us in how we're actually seeing and managing patients because, unfortunately, legs don't get better necessarily by themselves. But what we've done, tired, achy, heavy, crampy legs, blood clots still happen, ulcers still happen. So what we've offered patients, instead of everyone coming into the office all at the same time, we're spreading out our appointment times and slots. We're bringing more acute people in the office, but we offer telemedicine visits. So a phone call or a video visit with a provider from the comfort of your own home.
A lot of people are doing that, and it's really impactful, I think, because people are still able to get information to you, and you're still able to sort of assess the situation, right?
Absolutely. Early stages of vein disease can be really easily assessed just with telemedicine, a phone call or a video. If you want to take a picture and show us their legs, you can do that. But symptoms are really obvious. You know, the tired, achy, heavy, the legs that are just done at the end of the day, you have to elevate them, you're massaging cramps out of them at night. And those are very consistently symptomatic of venous disease. You don't have to have varicose veins or swelling, but a lot of people do. And we can actually coordinate getting compression stockings or compression socks so that you can start managing it a bit at home and not necessarily have to come right in for procedures. Moving our appointments so that we are limiting the number of people in the waiting rooms. We're using all of our rooms to triage. We're doing COVID screening of all of our staff and our patients. We're masking everybody. We always wipe surfaces down all the time. But we can bring people in a safe environment, assess emergencies like blood clots. We're doing a lot of blood clot treatment lately, and ulcer management to keep people away from the urgent cares and the emergency rooms and hospitals so that they can limit their exposure and also save those resources for folks who really need that acute management. Center
for Vein Restoration is in Fredericksburg. Now, tell everybody where exactly you're located if they do need to come and see you in person.
Yeah, we are at 301 Park Hill Drive, Suite C. So if you know where Mary Washington Hospital is and the emergency room, there is a bunch of buildings right behind emergency room, the Snowden Center. Health South used to be up on the hill there. It's now got a new name, but we're right in the complex behind the emergency room at Mary Washington.
All right, centerforvein.com is the website, and that's a really easy way for you to see the telemedicine that's available there. You can click to call. You can click to get on the telemedicine. It's a great way to do it, centerforvein.com. And Dr. Soto, thank you so much for still being available to everyone in the community and taking all the extra precautions, and we appreciate it. We're thinking about you guys during this time.